I'd like to extend an invitation to join me at the second annual Preventing Relapse Symposium by the Gorski-CENAPS Corporation in San Francisco, California, May 31st and June 1st. I'm going to be presenting on day one, and I'm going to be talking about working with people with chronic pain who have coexisting psychological, emotional, and substance use disorder problems utilizing my addiction-free pain management system. I'd like to invite you to join us. Now we're filling up fast, so I really want to encourage you. If you're going to come, sign up now. You'll see the links by this video. One of the things I'm going to talk about is covering all the obstacles that these people face to getting good treatment outcomes. And one of the big problems is there's been an overutilization of what we call the biomedical model. That's using medications, shots, interventional pain procedures, surgeries, and only working on the biological component or symptom management. We're not addressing the psychosocial spiritual domain at all. But the number one problem is we as healthcare providers fail to identify and or treat the coexisting problems these people living and suffering with chronic pain experience. Some of the mental health problems and substance use disorder problems. But we have another serious problem. We live in a quick fix mentality in this country, and there's a lot of people that will sign up immediately for these biomedical interventions. They'll be standing room only, but when it comes to making lifestyle changes, the window is empty. And what I believe we need to be working on is the whole person, bio, psychosocial, spiritual. This is indeed a synergistic treatment problem that needs a synergistic treatment solution. And the coexisting chronic pain, addiction, and mental health syndrome goes something like this. When the person with chronic pain and coexisting problems goes in to seek help, let's say they go to a pain clinic, now they're addressing one piece of the puzzle, the chronic pain. Let's say instead they go in to deal with their depression, anxiety, PTSD. They may go to a different provider and looking at their mental health issues. But let's say that they're starting to have problems with medication misuse, abuse, or even addiction. They may go to an addiction treatment program to deal with the substance use disorder. We call this sequential treatment. But what people really need is a different approach because of this syndrome, because 1 + 1 + 1 = 4 or more. That's what I mean by synergistic. And this synergistic problem needs concurrent integrated treatment. And I'm going to talk about what exactly that is during my presentation. So this synergistic solution is about healing the whole person. We need to deal with people's chronic pain, that's for sure. But let's say they have substance use problems. We better focus on that. Other psychological, emotional problems. And some people experience other coexisting physical problems like diabetes, maybe broken bones. They could have other problems besides their major chronic pain condition. They have psychosocial problems, their interactions with friends, family, community, work, and most importantly, I believe they're having troubles with their spiritual values, practices, and principles. Our goal is to improve their levels of functioning and quality of life in all 4 domains. So I'm going to invite you again to join me at this event, the second annual Preventing Relapse Symposium, sponsored by San Francisco's Health Right 360 at one of their facilities right in downtown San Francisco. And I look forward to seeing you and encourage you to sign up soon because space is limited. Thank you for your attention, and I really appreciate you joining me today.